Good afternoon. My name is Carol Money. This video is for CDIS 354-02.1251, the Multicultural Case Study presentation. First, since I do not have extensive information on Joshua, this assessment is really somewhat of a guess. I would need to work with him directly and observe him directly to know better how I would like to approach his treatment. The previous clinicians reported that he had a very short attention span of about 1 to 2 minutes and was extremely active, and that his home life was very unstructured. They had chosen toys that they felt were geared towards little boys, and these toys did not capture his attention at all, or his interest. So the first thing I would like to do is talk to the mother and find out what types of activities and toys he really does enjoy. If he primarily enjoys movement and lots of physical activity, I would certainly try to make the language activities have a physical component. For instance, using dance and music, lots of movement to keep him engaged. Another idea might be to have an indoor jungle gym, so that we could focus on action words, climbing, jumping, swinging, while engaging in the activities. Setting-wise, I'd like first to try 2 different things in different sessions to see what worked the best. The first way would be to work in his home directly in an area that he really enjoyed and with items that he liked to use. The second place I'd like to see that might work would be a pull-out method, setting area in another room where I would have maybe three different areas so that he would have to stay focused on 3 different things. So maybe an indoor gym, jungle gym type situation, or a mat in another area where he could do tumbling and dance. And maybe a third area if he likes musical instruments, for instance, with a keyboard or boom whackers or handbells, or perhaps something he brought from home that he chose, an item that he likes to play with that he could bring along and we could use in our session. So I think it's super important to find something that he is really interested in. He might not like the stereotypical little boy items. Maybe he likes to bake or play with dolls. So I think we need to investigate that a little more thoroughly and find what he really enjoys. I would also like to explore having the mother incorporated into the child's learning. Perhaps the It Takes Two to Talk language intervention program would work really well. It's geared toward the younger child and also helps the parent learn to interact. I think this would be super beneficial for both of them so that Joshua could continue to have some instructional interaction outside of our sessions. Also, Joshua might do well with the enhanced Malo teaching language intervention, since it's geared towards children that fit Joshua's demographic. For him specifically, the language delay and being from high-risk, low-income family. Obviously, Joshua's progress would need to be monitored and adjustments made if these things were not contributing to his success. Thank you for taking time to listen to me today, and I hope you have a great day.